Back to Pharmacy Talks with D. My name is Dutrochet Djoko, commonly known as Djoko. And today we're going to continue our conversation by talking about the effect of substance abuse in expecting mom, the effects of substance abuse in pregnant women. If you recall during our first episode, I did talk about my experience with this. I was an intern at a hospital as a pharmacy intern, and I happened to work in one of the local hospitals that had a jail, a prison on the 8th floor. And I still vividly remember this young lady who was admitted at the hospital. She was pregnant, and she was picked up on the street of Boston. She had used so much drugs. She started with opioids. Then when she couldn't put her hands on opioids, she went and continued with cocaine and heroin on the street. She had injected herself so much that the veins had collapsed on the hand. She would use the veins on the legs. She would even use the veins on the neck and try to get on a mirror so she can have access to those veins. She will even use the veins on the breast. And it left an indelible scar in my mind. And I always ask the question, why? Why would somebody do that? What pushes somebody to get to that point? And most importantly, what is the future of that baby? What will happen once she gives birth? What will happen to that baby? That's why today I decided to converse with you about the effect of opioids and substance abuse on pregnant women. And for that, I'm fortunate enough to have today with me Dr. Vanessa Mbanga. Dr. Mbanga is a physician and a clinical research assistant in neurology at Beth Israel Hospital. And I believe in June, she's going to be starting her training to be a pediatric neurologist. Let me get that right. And welcome to Pharmacy Talks with D, Dr. Mbanga.
Thank you for having me, Dr. Djoko.
Thank you. So, I was just talking about my experience with an expecting mom who had issues with substance abuse. Is that something that's unique, or is it something that's prevalent? How prevalent is it that we see or have expecting mom with issues with substance abuse?
So actually, opioid use disorders is on the rise recently. So like, for example, in 1999, we noticed that about 1.5 pregnancy out of 1,000 will have those disorders. Wow. But that was in 1999, and now lately in 2014, the number was 6.5 patients, pregnant patients out of 1,000. So that's like a 5-fold increase in about 20 years. So the issue is rising, and it's very concerning.
So this was not a unique situation. This was actually something that occurs quite often.
Obviously not. It happens.
Wow. That's so now when you have an expecting mom who is using substance or abusing opioids and using street drugs, what happens to the mom's body, and how does that affect the fetus?
Okay, so one thing we need to know is that when someone is pregnant, she actually has this organ that is called the placenta. Okay. The placenta is really the connection between the mom and the fetus, and that's through the placenta and then the umbilical cord that the baby is able to receive food and oxygen. But unfortunately, opioids are able to cross the placenta from the mom to the baby. That's what causes all the issues. And at the level of the placenta itself, the opioid can cause some dysfunction, which leads to less oxygen that gets to the baby and less food and nutrients that get to the baby. That's really the cause of all the consequences.
So basically, when they are used, from what I gather, when an expecting mom uses opioids in abundance, it goes to the placenta and affects how much oxygen the baby is getting.
Exactly.
And I suppose that could cause fatality. That could And the pregnancy, I suppose?
Yeah, it does. You can have some baby that will end up passing in the womb, in the mom's womb, and you can also have some premature delivery. There are many consequences of that
The
condition.
use of the opioids.
Yeah.
Wow. And then now, in the event that, you know, the baby survives that first step, which is while they are in the womb, and the mom or the expecting mom goes on and deliver, I suppose there's going to be consequences even if the baby was able or the mom was able to get to term, right? There's going to be consequences to that baby even after they deliver.
So one thing that we need to know is that from until about 8 weeks, most of the main vital organs of the fetus are already developed. Things like the brain, the heart, and some parts of the abdomen. So when the mom gets in contact with opioids early in the pregnancy, on the later baby, you can have some congenital heart defects that can arise. You can have some abdominal malformations, and you can also have some brain and spine issues. But one thing that I really want to emphasize on is the neonatal abstinence syndrome. So that's because, like I said earlier, the baby has been exposed to opioids in utero, in the mom's womb, and when he comes out, there is like, he has no more support, like he has no more opioids to, you know, keep him up.
Okay.
So he gets into a withdrawal. And then the baby is going to present with tremors, with irritability, with diarrhea, vomiting, seizures, and all of that. And that's really a medical emergency. We need to react as soon as possible. So if ever you experience something like that, it's really good to come to the hospital as soon as possible because there are treatment options in those circumstances.
Wow, that's scary. Basically what you're describing is, you know, the mom was using and she went on to deliver what she thought was a healthy baby.
Yeah.
And maybe when she gets home, she gets that syndrome. Is that what I'm hearing?
Yeah, it could happen at the hospital and even within the first 21 day from delivery. That's a neonatal window. So it could happen during that time.
So just because you think you have that healthy baby at the hospital doesn't necessarily guarantee that you may not develop that condition once you get home.
Oh no, you need to watch out. You need to watch out for the symptoms. Like if your baby starts having fevers, tremors, like the baby is shaking, or seizures, irritability, the baby is not feeding well, and things like that, you really have to come to the hospital. And other thing that I would like to mention is that because of, you know, that use, because of the lack of oxygen and the lack of food to the baby, you have baby that really comes with a low birth weight. So which makes things very difficult. So they need to be, you know, surrounded and really well taken care of from that time.
So it's from what I gather, it's important for a mom. I mean, we hope nobody uses, right? We hope nobody abuse opioids or all kinds of illicit drugs out there. But in the event that somebody does, what I'm gathering is it's important that even if their GI was not aware of it, if they're expecting and they're going to be delivering, it's important to let the healthcare provider know that there was something going on so they can pay a little more attention.
Sure.
And when you get home, it's also very important to keep a close eye on the baby after discharge.
Definitely.
Wow. And something that I always wondered too. Now, what about this mom? If you have someone who was using and who was, you know, abusing opioid and things like that because they were not pregnant, and then all of a sudden they realize, I'm pregnant now.
Yeah.
Are they doomed to fail, or is there anything they can do to? Because I'm sure, I mean, sometimes, you know, getting to that level of pregnancy might give them an aha moment where they feel like, okay, you know what, I really need to get my life together now. I wanna go clean. I wanna get my life together. Do those moms have any chance, or the fact that they know they're pregnant and they want to change? What's out there for them?
So once you know that you are pregnant when you've been using those drugs, it's very important to get to your OBGYN right away.
Okay.
You shouldn't stop your using at once, because that can cause like a withdrawal at the level of the fetus, which is even more dangerous for the fetus. So when you go to see your physician, there are treatment options. They are going to provide you either with methadone or buprenorphine,
Okay.
which is, another way to supplement it, but that is less risky for the baby. Actually, for patients that are on the treatment, we have experienced less events of neonatal abstinence syndrome, and even in the event of, if that occurs, the condition in the baby is very more less severe.
Okay.
So it's definitely important to get in touch with your physician.
Okay. So if you're using or abusing, and you realize that, now I'm expecting, it's really important to, get to your OBGYN or your primary
Exactly.
care, whatever, to get to the healthcare professional right away, because from what you're saying, there's a great possibility that, you can get to treatment
Exactly.
and make sure that the baby doesn't develop all
Those
the conditions
complications,
and
yeah.
complications that we spoke about.
And even if it happens, it'll be less severe than without the treatment.
Okay.
So it's better to be on the safe side.
That's right. Wow. I mean, this is important conversation to have, and I can't thank you enough, because this is something that I'm personally very passionate about, and I have a very simple philosophy: saving one life is one life too many. But I'm glad that there's a possibility, not only for the pregnant woman to get better, but that even after the birth of the baby, we can actually do things as long as you seek medical attention as soon as possible,
Yeah.
to help and save the baby.
Exactly. And one thing that I would like to add is that when you seek the medical attention early, if you have any other comorbidities like HIV or hepatitis, it's very easy to address all of those, so that the maternal to fetal transmission doesn't occur, so that at the end you end up with a baby that is, doing so well.
Healthy.
Yeah, healthy.
So basically what you say, you can have an expecting mom who, if she discovered that she's expecting, and unfortunately she was abusing, if she seeks the medical attention early, even if she had comorbidities like HIV and Hep B and things like that, she can still have a healthy baby.
There are treatment options, yes. So it's good to have that conversation with your primary care.
I can't thank you enough for this. This is great news, because I've been giving you so many statistics of, one person passing on every 11 minutes or so in the U.S. according to the CDC from overdose. So I'm really glad that there are treatment options. And today, since we're focusing on expecting mom, for the people who are expecting, not only to get better themselves, but also for their kids. So I want to thank you very much, Dr. Mbanga, for stopping in today and giving us some insight into what is it that's out there available for expecting mom who are struggling with this condition. Thank you very much.
My pleasure. Thank you for having me.
And this, I'm glad that we do have treatments for this. I'm glad that there's a possibility of seeking treatment. But what I also know is that there's a lot of myth out there. And I'm glad Dr. Mbanga was able to elaborate that and confirm what I thought, that, all is not lost. If you are in this condition, you can get better. You can save your life, not only your life, but your baby's life. But I also realized that there's a lot of myth out there as far as the treatment for substance abuse, opioids, and illicit drugs. And I was looking at the American Addiction Center, which I label AAC, had about 15 drug and alcohol recovery myths that I would like to debunk, because as Dr. Mbanga said earlier, you can seek the treatment and you can get the treatment. And talking back to the story of the lady that I met when I was a pharmacy intern, why didn't she seek the treatment? What are the roadblocks? And I know some of these myths constitute roadblocks and prevent people from seeking treatment to get better. Myth number one that I'll talk about: I'll lose my job if I go to rehab or if I seek treatment. That is not true. Because if you're already struggling with the addiction, most likely your performance at work is not good, and your boss may even know that there's something already wrong. So seeking treatment is not going to make that worse. It can only make that better. And most employer will give you sick time. Some will give you vacation. Some will give you family leave. Sometimes it's paid, sometimes it's unpaid. So the fact that you're afraid to losing your job should not prevent you from seeking the treatment, especially if you're an expecting mom. Myth number two that I would like to talk about is I can't afford it. It's too expensive. I'm only making ends meet. I can't afford the treatment. So that's also a myth, because you abusing the substance is already very costly. You got to buy the drug sometimes, on the street, which is a lot of expenses. You're losing family, friends. And it could be as costly as costing you your life. And there's nothing more than your life. So saying that it is too costly should not prevent you from seeking treatment. Moreover, there's a lot of insurances out there that offer treatment in their plans. And that's something you definitely can look at. Look at the program that you want to get in. Is it in network with your insurance? Because that will cost them less and they'll be more likely to support you. But just doing nothing and saying, oh, it's too expensive, I can't do it, in my opinion, it's not an option. There are possibilities. And if you have no insurance at all, I believe it is the Substance Abuse and Mental Health Services Administration. I usually refer to it as SAMHSA. They can help people with no insurance get treatment and get better. Another myth that is out there is rehab is like a boot camp. Well, I can tell you that there's been a paradigm shift as to how we look at this condition. It's no longer that you're a quote unquote junkie and you can't help yourself. Why can't you just help? No. There's a paradigm shift where we're lifting the stigma associated with addiction and treating it as an illness, like any other illness. So there's a lot of program out there, and in those programs, they do have empathy. They care. They are there to help you. So don't feel like you're getting in some kind of boot camp. Another myth is boring. Right? You hear people say rehab is boring. I believe that if you get to a treatment center, what you get out is what you put in. If you want to make it boring, it's going to be boring. But if you look at it as the beginning of a new life, if you look at it as a chance for you to get better and live your life sober, it cannot be boring. One more myth, because these are the things that people that could prevent. These are some of the roadblocks, and people will sit back and say, that's not for me because of ABC. Another myth is all the drug and addiction programs are the same. I saw, no, they are not. There are different programs and different recovery follow different treatment approaches. So you have options. If one is not suitable for you, you do have option. But the most important thing is that you seek the help that you need. There's hope out there, fellows. All is not. We focus a lot on prevention, especially with our youth. But in the event that you have a family member or a friend or a co-worker who is struggling with this condition, there's a lot of hope out there. And they should not leave these myths prevent them from seeking the help that they desperately need. Another one is, everyone will find out that I'm an addict. So, I can't go to that program or to that treatment center because everyone will say, he's an addict. Well, I can here show you that we have what we call HIPAA. All these centers have some privacy concerns, and they will not divulge your information to other people. So that should not prevent you from going to seek treatment. And if you think about it, if you're already struggling with the condition, people around you might know that there's a problem anyway. So it'll be better to take care of it and seek the help that you do need without worrying of the fact that people will know about it or find out about it. Another thing that I hear people say is, no one will understand me. People will not understand me. People, you don't understand. You don't understand my situation. Well, number one, in those treatment centers, there are trained professionals, trained healthcare providers who understand. And not only that, you might be inspired by some of your peers when you get there. So again, you only get out what you put in. Another myth is, I'm too old. What do I have to gain? I'm too old. This is not for me. If I was young, if I was younger, I would do it. But right now, I've been using so long, I'm too old. There's nothing I can do about it. Not at all. Old, young, you can still go and get the help. Because just because you're old doesn't mean that you want to continue to live a healthy life. So your age should not be a roadblock for you seeking the treatment that not only you need, but that you also deserve, in my opinion. Another one is where I'll put my whole life on hold. If I gotta go to a treatment, it means I gotta stop everything I'm doing. Some people have families, some people have their jobs, but that also should not prevent you, because there are inpatient treatment center and there are outpatient treatment center. And based on your specific situation and what is going on, there's a possibility that you do an outpatient treatment center where you live your life as normal as you can while you're still seeking the treatment that will make you better. So these are some of the things that prevent people from seeking the treatment that they need and that can change their life and help them live, a normal life, if you want to call it that. Another myth that I hear all the time is substance abuse treatment is a quick fix for addiction. People think, well, I already went in and out of the center twice, so there's no hope for me. It's not. Once you seek the treatment, the way to recovery is not quick. It's not supposed to be quick. It's true, it depends on how long you've been using and what your using habit is, but you need to understand that the way to treatment is not quick. It takes time and it takes hard work. But in the end, I promise you, life is so much better sober. Life is so much better sober. So getting clean takes work, and everyone is different. But the effort you put in is what you're gonna get out. And another myth is, if you go to treatment, religion is gonna be forced on you. They'll try to make you like all religious, where all the treatment centers or programs are not the same. That's also a myth, thinking that religion is going to be forced on you. Some people would prefer treatment center with that, higher power involved, but other people, there are other treatment center where religion is not part of it. Whatever the case is, this should not prevent you from seeking the treatment that you need. And as Dr. Mbanga said, there's hope. There's hope not only for the expecting mom, but there's hope for everyone out there that is struggling with this condition, that is struggling with substance abuse. Another one is detox is a nightmare. Because you will think of the withdrawal symptoms. Like some people try to quit on their own and they're unable because they get withdrawal symptoms and their condition gets worse. Well, fortunately, when you seek treatment from the proper healthcare professionals and from these programs or centers, they're professionals. They know what they're doing. And there are ways to help you with those withdrawal symptoms. Sometimes there's medication assist detoxification that we can use if it's suitable for you. So just because you're thinking of that withdrawal symptom when you try to quit on your own, that should not prevent you from seeking the help that you need to get better and live a life without substance abuse. And the last few things that people talk about is, I need to hit the rock bottom before I seek treatment. I can still function, I can still go to work, I can still care for my kids, I can still care for my family. So maybe if I hit the rock bottom, then I will seek treatment. No. The sooner you seek the treatment, the better it is. And hitting rock bottom varies. It's not the same for everyone. So thinking that you want to hit rock bottom before you seek treatment is not a good idea. And I always say this, sometimes you don't have a second chance. Sometimes you don't have a second chance. So it's important to seek the treatment as soon as you can. And the last myth is rehab is a waste of time, where a lot of studies have shown that the people who go to rehab, and sometimes you could go in and out 1 or 2 times, that's okay. But studies have shown that the people who actually decide to get their life clean, who go to rehab, who enter these programs, are less likely to relapse. So just because you may have failed the first time doesn't mean that it is a waste of time, because you're more likely to be sober if you've received treatment than if you have not. Those are some of the myths that are out there that I really wanted to rebut and share with you, because as Dr. Mbanga said, there's hope, there's a way for you to get sober, and hopefully we don't get there, because of all the preventative work we do. But in the event that we do get there where somebody is struggling, all is not lost. On that, I thank you very much for your attention, and I will see you next time so we can continue our conversation. Saving one life is one life too many. Thank you very much, and bye-bye.